Hi, everyone. It's Dr. Z, and welcome to Next Up Narcissism. Today, we have somebody who I think is so smart, and she does the most interesting stuff. Her name is Annie Särnblad, and she is a world-renowned expert in reading facial expressions, or what we call microexpressions. She is an author, a speaker, and strategic advisor. She developed her own easy-to-absorb teaching techniques for facial expressions based on the knowledge she accumulated living in 9 countries and studying 8 languages through immersion. She is also certified in the facial action coding system and has a master's in cultural anthropology. Annie basically is a human lie detector. And in this, we go through all different emotions, all different emotional states, narcissistic personality disorder, and how your micro expressions or facial expressions really tell everybody what's going on, even if you don't realize that you're doing it. It's kind of like it seeps out anyway. So this is a really fun episode. I highly recommend that you check this episode out in particular on YouTube because Annie uses a lot of facial expressions to demonstrate what she's speaking about. It's a great episode. You're going to learn a lot, and I will speak to everybody soon. Enjoy. It's Dr. Z. Welcome to another episode of Next Up Narcissism. Today we have a very special guest who does extraordinary things, and I'm so excited for her to be here. Annie, I'm going to turn it right over to you. Just kind of give everybody a brief overview of what it is exactly you do.
So I do a lot of things, but here today we're mostly, I'm like a mom, I'm a lover,
right. Other than an Uber
all
driver,
of the things,
mom,
yes, right, exactly. Like I have so many.
What else do you do?
What else do you do? I teach microexpressions, and microexpressions are the facial expressions that precede the thought process, that are involuntary, that have nothing to do with culture, gender, socialization, geographic location, age. Microexpressions are the same even for people who are born blind. So they are a species thing. It's a physical response to emotion that we all have as human beings. So for example, humans, when we're scared, the blood pumps down to our legs and our feet and our hands get cold. Right. So we can run, we can escape. When we're scared, we also pull back our upper eyelids so we increase our field of vision. When we're really terrified, we do this whole rectangularization of our mouths so that we can open our mouths as wide as we possibly can so we can scream. Humans, when we're angry, the blood pumps into our fists so that we can fight. We have a physical response to emotion, to each emotion that's separate and unique, that changes the blood flow and the muscle movement. So, we all know that humans.
So it's all, right? it's evolutionary. It's embedded in us. Yeah.
Yeah. So I always end up with this piece of like human beings cry when they're sad. And when humans are aroused, they get erections. When men are aroused, they get erections. And that's where you get the men in the room. They're like, oh, there's a change in blood flow and muscle movement that's specific to arousal. Hopefully you don't get an erection because you're sad or you're angry. But then that's above my pay grade. Maybe they need to talk to you.
Then they come to me. That's more my...
We can do some teamwork here.
That's so true. So for those of you listening, one of the things that Annie does when she's being interviewed is she shows a lot of examples on her facial expressions that she does. So obviously for the podcast, you can't pick up on that. We will do our best to explain it. But this is definitely one of those episodes you're going to want to watch on YouTube, on my YouTube channel, just to kind of get the full experience of this as she kind of points out on her face what she's kind of referring to. So we talked obviously briefly about why it happens. It's kind of this built-in response to keep us safe when we know that our bodies have multiple built-in systems to keep us safe, prevent us, from even eating poisonous foods, from, approaching danger, things like that. And it's like you said, it's there when we're born, regardless if you can see where you're from and all that. But I guess my question is, over time, as people have experiences in their life, as people, let's say, have a traumatic experience happen to them, or They, let's say, have a very neglectful upbringing, neglected by their parents, or let's say they move around a lot and they're never really settled, and things like that, just life. How much do those life experiences, especially the really significant ones that stand out, how much do those experiences alter or change, or does it not, these kind of built-in microexpressions that we have?
So it doesn't change the microexpression. So the microexpression of fear is the same regardless of individual. What makes somebody feel fear is different from one person to another. So it's like, again, I was kind of joking with the erection, but the reality is that we have human beings cry when we're sad. Not everybody, unless you have a medical condition or unless you're really closed off, but when we are feeling sadness and extreme grief, we cry. We cry sometimes more as children. We would still show the micro expressions of sadness. And the micro expression of sadness is most easily viewed as a puckering of the chin. So if you think of the chin as a soft, smooth grape, if you actually touch it with your index finger, you can feel it's pretty smooth. And when you pucker it, it does a couple of things. It turns that grape into a little raisin, all puckered and dimpled, and it takes the middle.
So it's not wrinkles?
Yeah. No, it's not wrinkles. I, by the way, really like wrinkles because they show all your feelings.
They show all your feelings.
All your tenderness. And it pushes the lower lip up and out a little bit. We all know that when we see a little kid about to cry, and and then the sound comes, right? But with a grown-up, you may be asking someone in front of you, and how are you feeling today? And they go, great. And they pucker their chin. Well, they're not really feeling great. That's their body leaking. The microexpression is the leakage of emotion.
Is that because they're lying and don't want to tell you, or is that because they're not able to identify that they're sad? I guess my question is,
could be either one.
So even if you have no emotional awareness that you're sad, like let's say you have a migraine because you never show your anxiety, instead it's somatic. So you get anxious, you get a migraine, you don't feel anxious, you feel fine. And you're doing what you do, and I'm talking about something and I have a migraine, you'll still see those micro expressions that.
Yes.
Wow.
Yes.
Okay.
And so what as you're talking, I can feel my chin puckering, and that's a piece of empathy. So I'm showing sadness for the person who's feeling the migraines and having a rough time, even that. So you know as well as I do that people lie to themselves all the time. The body leaks. So for example, one of the examples I use all the time is if you've got a coffee cup and you touch the coffee and it's really hot, or take, for example, a boiling pot of water and you touch it. The first thing that happens is you yank your hand back before you even realize what happened. So the muscle movement precedes the moment of cognition. That's the same with the microexpression. So we actually need the facial movement to send a message to the amygdala to process that emotion. So too much facial paralysis actually impedes that emotional processing.
Okay, so hold on to, because you know what's coming. You know what I'm about to ask you. Okay, so regardless if I identify the emotion, if I am, almost like alexithymic, just kind of like, I'm flat, I don't really identify anything. Could it be a therapeutic tool to have people that are closed off or who are, let's say, very bad at recognizing, identifying their emotions, if they knew what microexpressions were, would they be able to use that to say, oh, okay, I'm doing this, so I must be anxious. So this is what anxiety feels like, and maybe kind of learn from that? Is that something?
Yeah, so I mean, a typical example that I use when I'm teaching is I'm not a fashionable individual. If I could go walk around in scrubs every day. I worked at a geriatric hospital for one summer when I was going to school in Sweden, when I was going to college, and they gave us scrubs every day. It was the best thing ever.
Sounds lovely.
I didn't have to think about it. Everybody was wearing the same thing. There was no judgment. I am not
as I'm in my hoodie.
Right. I'm not a visual person at all. I literally have almost a uniform that I wear when I work. And I just am not a visual person. I fully recognize that when I go on stage and speak to 800, 1,000 people, I need to look presentable. Mm-hmm. And so I have to go and I have to buy dresses and fancy shoes and all that stuff. And I will walk into a store and I will look around and I'll go, oh, no, I didn't like that one. I will use the facial expression of disgust or the no face to get to a point. Oh, my face didn't move on that dress. I'm going to try that one on.
If I really?
buy
That's
something that my facial that I show disgust, it will hang in my closet. I'll put it on. I'll try it on, and it'll live in my closet. It will never see the actual light of day. And my whole body knows if I like something or I don't. And I can't. I use that more than my thinking brain, because my brain wants to do what I should like, and my face just says what I do like. I do it with men too.
Yes. No, because I mean, here's the thing. I mean, our thoughts, and for everyone listening, we talk about this all the time. Our thoughts lie to us, right? I always say, like, our thoughts are assholes.
But here's
our thoughts lie to us. But the facial stuff won't lie.
It won't lie. And so that's the whole thing. And that's where my obsession came with not feeling like as a child, I couldn't trust the people that were supposed to keep me safe. Mm-hmm. And for that reason, the nonverbal that I didn't have words for felt safer than the words. And so with dating, if I want to know if I'm actually attracted to somebody, all I have to do is think of them naked. If I make the disgust face, then I'm like, that's not going to, I'm just literally not attracted to them. That's not going to work. So I don't even start.
That is fascinating. So I want to go through a couple mood states, and you kind of tell us what we would expect as far as a microexpression. And then I want to get into more of the lying, deceit, trauma, and that stuff. So somebody's really angry, let's say, but they're not telling you they're pissed off at you, but they're angry at you. What's something that we can look for in their face to know if they're being upfront and honest?
Okay.
About being angry.
All right. So what I've done with the entire field of microexpressions, I'm trained in something called facial action coding system. I'm certified in the work. And if you're interested in microexpressions and facial expressions, Paul Ekman, Wallace Friesen, Joseph Hagar, David Masimoto, there's a bunch of really interesting academics. Most of them have a background in psychology that have really studied this and researched this. And I would absolutely recommend their work. What I've done is I'm an anthropologist, and I have gone out and done field work. So I go out and press buttons at cocktail parties, at the bus, with my children. We do social experiments constantly. And so I've taken, together with my kids, the entire field of science and simplified it. So I'm very interested in teaching what I feel works and what is really sort of simplifying the entire field. I'm sure some of my colleagues in the field of academia would disagree with me, but this stuff works. Okay, so the simple piece of anger is that when we are angry, we furrow our brow. These are actually, Darwin called them our concentrating muscles. Charles Darwin was one of the first people that we know of that really categorized facial expressions. So if you've got too much Botox.
That was my next question. So I'm trying to make the angry face, and I don't have the lines, right? Because I have Botox in there.
I know.
Thank you, Ron Stark. But here's my question. So if Botox and fillers and plastic surgery, all of that stuff disrupts the microexpressions, then there is no microexpression to read.
Right. And then there is a disruption in the problem solving and the emotional processing.
Can you explain that a little bit more? So my brain is not picking up on the cue that I'm angry?
Yes, your brain is probably not even fully feeling the anger as much. It's one of the reasons that Botox helps with depression. Yeah.
Wait, talk about that, because why Botox helps with depression.
So
what's the process behind it?
These are our muscles that we need to do to ruminate. Right? If we freeze these muscles, it's harder to ruminate. It's almost like putting our brain on pause. It's like, well, this is such a big problem. And no, it isn't. I can't even move it. Right? It's like numbing pain.
If that's the case, I should never have an ounce of anxiety in my life.
Well, there's worry somewhere else. There's just worries in other places. So this piece is problem solving and anger, right? The furrowing a brow. It's one of the reasons that if somebody is deep in thought or deep in concentration and they have this look, somebody else a family member might walk into that room. I'm starting to make myself really crowded. Might walk into the room and say, "Why are you so angry?" And they're like, "I'm not angry. I'm trying to solve the wedding seating, blah, blah, blah chart. Or I have 3 events that I want to do this weekend. that are all, I really want to be there for all of these three things, and two of them are happening at the same time. I'm problem solving. The reason problem solving is a piece of anger is because there's something that needs to be fixed, solved, changed, something that's unjust or wrong, like it needs a solution. So in all the things that we were talking about before we started actually recording this, when we were talking about the state of the world, we then try to furrow our brow because we're trying to, like, what could we do to improve it? It's a problem solving mechanism. Anger is always going to have a clench. Anger clenches everything in our bodies. It really just is this giant, that's the way I teach it. It's a clench. It's a clench of our fists. It's a clench of our intestines. It's a clench of our butt. It's really everything clenches. It's one of the reasons it's harder to poop when you're really angry. But it like literally clenches our mouth. And that's where you're going to see it on the face, is the tight lips. If the lips are nice and loose and regular according to our baseline, for example, so every microexpression, we're looking for the change on that individual's face. The actual phenomenon, the muscle movement is going to be the same, but it's going to look different because my mouth looks different from your mouth and everybody else's mouth, right? But you're going to see a difference, and it's going to clench. Whether the mouth is open and talking, it's going to be tight. Whether or not it's closed, it's going to be tight. My lips are so thin that they almost completely disappear when I'm really mad. It's almost a thin white line. Yeah. So anger, that's been the obsession with me and the kids, is figuring out that one piece of each facial expression where you can quickly look and that shows that emotion clear as day.
It's fascinating to me.
It's so fun.
What about disgust?
Mm-hmm. Disgust has three main pieces. Its actual function is to shut off the nasal passages so that we're not inhaling something that's gross. It has the wrinkles on the side of the nose, the deepening of the nasolabial furrow. I sometimes just call this the nostril shadows because it's easier to remember. Nasolabial furrow or nasolabial fold is also used interchangeably. Those are big words. And it's got the pulling of that upper lip. So, that 7th grade girl who's like, really going to wear that?
Like my daughter.
Yeah, I mean, they go through that age where they show a lot of displeasure.
Yes.
I call that the no face, because anytime somebody makes that facial expression of disgust, there's something that they don't want. There's something that they're saying no, negative. So if I'm working with mergers and acquisitions and teaching people to do high stakes negotiation, and they see the micro expression, which is that little twitch right there, that's the no. That's, I don't like that. And the micro expression shows what someone is feeling, but not what they're thinking. So we don't know exactly the why.
Right.
Just shows so if somebody's crying, we don't know why they're sad necessarily. I mean, we can guess, but we don't know why they're sad. We just see that they're crying. But we're sure that they're sad.
This is one of the reasons why I tell people too, and even though a lot of the cognitive behavioral therapists will disagree with me on this, but they tend to be more behavioral in my approach, that our thoughts and our feelings and our behaviors they're separate. They're separate things. One doesn't necessarily cause the other one to happen. And exactly like you said, you could be in a state of disgust, but we have no idea what you're thinking is. Having a thought doesn't change the fact that you're in a state of disgust. Neither of those can affect your behavior.
Right. And I may go ahead and close that deal anyway, but there's something I'm not pleased about. And so if you're in the middle of a negotiation, whether it's a romantic negotiation or business negotiation.
Yes.
And you say, hey, do you want to hang out next weekend? And you see this look of disgust. That doesn't necessarily mean the person doesn't like you or that they don't want to hang out with you. It could be that next weekend doesn't work for a variety of reasons. But it shows you that there's something going on there, so you can pause and you can, hey, would another time be better? What would you like to do? So
you know what I'm thinking?
Yeah.
That's actually really interesting, that it's not that you're making the face of disgust because you're not interested in the person, but it could be because you have work to do and you really shouldn't go out with them, but you have work to do. And if you're a people pleaser, I could see how this could be super helpful for you to identify in the moment when you're breaking your own boundaries.
Correct. That's exactly right. I use it all the time. And the kids and I use it. My kids are big now, 18, 20, and 22, but we use it all the time, and we use it with each other and on our own faces. So for example, if I say, let's do this, or do you want to let's have this for dinner. And one of them goes like this. And often it will be just, I had that for lunch, but it's this quick, would you rather, I can just as easily do pizza.
Yes.
Like,
so it's not a personal thing on the other person. It's just.
Well, it Could be, right? But it's not necessarily.
But it's not necessarily.
Yeah.
Interesting. So you mean it's not always about us?
Go figure.
What?
What?
So how about numbness? When somebody's just not feeling anything, that kind of really scary numbness phase that sometimes we have with severe depression. Or it's not depression, but it's that nothingness.
So sometimes there's a frozenness and there's really very few microexpressions. And then the one thing that I always look out for, I've got some grief on this for, sometimes people will take like a little, so that's what social media is, right? It's a little clip, sometimes a 30-second clip for me talking about something. But there is a facial expression, which is a piece of fear. So remember, I talked about fear is the hard pull back of the upper eyelids that actually increases our field of vision. There's a facial expression that's connected to that, which is this hard pull back of the upper eyelids, which is sort of a disassociated gaze. And I do notice that a lot of people who have committed violent acts, you can find photographic evidence or video evidence that they have in the preceding weeks or months made that disassociative gaze a lot of times.
I know those eyes that you're talking about.
And that makes sense, and that you would kind of have to disconnect with your humanity to be able to do something horrific. It is not proof that somebody is going to create, take action or become violent towards themselves or towards somebody else. But it is what I would consider when I work with therapists and when I work with doctors and when I work with parents. I teach them to pay attention to that hard Elizabeth Holmes, Anna Delvey,
yes,
a lot of these, when they're emotionally volatile. And then when that came up on social media, I had a lot of people with autism that reached out and said, I make this facial expression all the time when I disconnect. And my thought is, yes, it's a disconnecting expression. It does not mean that you are going to be violent. What it might mean is that you're completely overloaded and overwhelmed. And we can understand that somebody who is violent has had moments of being overloaded and overwhelmed as well that have, there is a correlation there. It does not mean that you're absolutely going to be violent. But I will say, if I say to someone, if you have a loved one who is walking around with the hard pearl of their upper eyelids, so fear is a quick expression. It's a quick, oh my God, you scared me. But if you're walking around with the hard upper eyelids pulled back, there's something overwhelming, really uncomfortable that you're disconnecting from. And I would say, try to get and give help. And if it's above your pay grade, send them to somebody that can, like you, that can help.
Yeah. No, I know that gaze. You feel it in your soul. I know that gaze. What's interesting, not to get too off topic, but when you were talking about autism and how it can mimic that disconnect that you see, let's say in somebody that's, in that kind of cluster B personality. What's interesting is that narcissistic personality disorder and autism oftentimes they're inherently different.
Yes,
they are extremely different.
Yes.
But one of the things that happens sometimes is that somebody who has autism can sometimes, people feel like, oh, they're so narcissistic, when they're not.
No,
they just have difficulty with social cues. They have difficulty, kind of navigating that environment. So it may seem that they're talking about themselves, or they're not engaged, or they're not listening to you.
Mm-hmm.
But the function of someone who's doing that, who has autism, is inherently different than the function of somebody who's a narcissist and doing it. The behaviors on the surface may look the same sometimes.
Correct.
But
right.
The functions, the person who's autistic is not lack empathy for you, not care.
No. In fact, one of the things that I talk about when I teach is this piece of, so first of all, my students with autism have historically been by far my highest performing students. Now, to be fair, autism that presents in a huge variety of ways. Most of the people that I have historically worked with on the spectrum tend to have very mathematical minds. And I'm sure I'm not using the correct vocabulary, keeps changing, and I'm doing my best. but my students have been really, really good at pattern recognition. So they have outperformed the neurotypical students, and they're really, really good, which I found fascinating, at instead of saying what the person should be feeling, just reading the map of the face as it is and saying, okay, this is exact, but yeah, maybe you think they should be angry in this situation, but they're actually showing grief. And that's been really interesting. When I worked with young people with autism, I always would work with the parents separately, but with the parents also, so they had a joint vocabulary so they could discuss it. And so the idea, at least and I have family members with autism, I'm quite familiar with it, but I'm not certified or qualified or educated to diagnose it. I recognize it. But what I will say is the people with autism in my life have an extreme amounts of empathy. They don't always have the theory of mind, or what I sometimes call situational empathy, which they sometimes can like jump right into. Oh, we know exactly what you're feeling. There needs to be some more translation.
Mm-hmm. Yes, but that's the piece I think that people misperceive as narcissistic. Yes, but the function of it is nowhere even near the same. And so, it's interesting that the microexpressions kind of fall into that same situation.
Well, and the narcissist can often see that the person they're talking to is sad and they don't care.
Correct.
Whereas a person on the spectrum might not notice that the person is sad, but they care deeply.
Exactly.
It's
exactly. They don't recognize it to respond, whereas the other person recognizes it and chooses not to respond on purpose as a manipulative strategy, right?
Right, and then I would just say that autism, if we take away the individuals with autism, our world would be terribly bleak. I mean, some of these brains are absolutely extraordinary and a huge gift to humanity. So
yep, I agree. So I'm gonna kind of lean into more of the trauma realm of this, and the narcissistic personality disorder and how microexpressions play into that. But let's start with lying and deceit. So if you know that, I want to know the difference if you are doing the lying and what your facial expression looks like once you realize that you're being lied to.
Yes. Okay, so all three of my kids got into college, or I don't know, that's how they got into college. All three of them wrote versions of an essay, completely different, about what it was like growing up in a family where you can't lie to each other. Because it just doesn't exist. I mean, that doesn't mean that we've never lied to each other. It just means we get called out instantly. And almost to the point where it's sometimes become a sport at the dinner table to see like what you can get away with. And it doesn't last more than 5 seconds. Every once in a while we'll be like, all right, we're just going to let you think that and just pretend, just to give somebody some privacy, because we all need some privacy sometimes. But I'll give you an example.
I'd be nervous at your dinner table.
I know. I mean, what it is, we're hysterically funny. I mean, and it's fast moving, it's witty.
That's
and
amazing.
Quick. But what I had, I was in the process of getting divorced from my ex-husband, and I was going to see an old friend for dinner, and my son just took one look at me and he goes, you like, and that's a knowing smile, by the way, that's just tucking the corner of the lips into the cheek, one corner. And he goes, you like him? I said, what? And he goes, your pupils just dilated when you talked about him. It's like, crap. So shitty.
You guys need to walk around with sunglasses or like a mask or something. So what'd you do during COVID? You couldn't read anyone's facial expressions during COVID?
No, it's not a problem, because like when I was talking about that sadness, or the puckering of the chin is a piece of sadness, it's a piece of vulnerability, and it's really vulnerability. So vulnerability is a piece of sadness, empathy, and of love, any kind of love. Like when we see a kid that's really cute, we go, oh, my baby is so cute, or the puppy dog is so cute. That automatically puckers our chin. Vulnerability is a piece of love, because there's always a possibility of losing the person you love. It's sadness because we feel grief, and it's empathy because we feel sadness for somebody else, right? We feel compassionate, and that makes perfect sense. So all of these facial expressions, they're kind of like Legos, and you build the different building blocks together to form a sentence. It's a whole language. It's our original nonverbal language of our species. So COVID, for example, would cover the bottom half of our face, but the top half of our face is still going to tend, it's a one facial expression I really can't do on purpose. But when we're really sad or achy, our eyebrows go up in the middle. They tend to in the middle. So if you have eyebrows that point down and your inner eyebrows raised, they may just sort of like two caterpillars poke towards each other. And if you think of them as caterpillars and they're already sort of your baseline is to have them straight across, then they're going to tend more up. So we're looking for the movement from the baseline.
From the baseline. Interesting. Okay.
Of that individual's face.
So let's say that you grew up in an environment where there was trauma, right? Or, you had some sort of negative traumatic experience or complex PTSD where it was kind of over time, routine abuse over the years, not just an isolated event. What happens to the microexpression when trauma's involved? When you're seeing, one of the things about PTSD is we look at stimuli that is totally unrelated to the trauma, but yet we respond to the situation or the object or whatever it is, or the person, as if we are in the same level of danger as we were during the trauma. And so we kind of trick our brains into thinking we're in danger, and therefore, our stomach tenses up, our muscles tense up.
So you're talking about what I like to call hurt attribution bias, which is often called in your field as a hostile attribution bias. But because it was hostile attribution bias is used, my understanding is so much in the context of saying people are overreacting.
Yes.
I like to use hurt attribution bias.
Yes.
I was hurt by a similar situation, and my expectation is that I'm going to be hurt. I have one ex-boyfriend that I always feel like my initial response to him is of pain and hurt.
Yes.
And it's just because of historic patterns. He's a much nicer grown up than, he was anyway, long story short, he's not actually trying to hurt my feelings. And I have to pause because I slip right back into this little kid who was hurt by him.
So will their microexpressions be accurate, or will your microexpressions be consistent with fear?
So my microexpressions, if I am my microexpressions are showing what I experience, right?
Okay.
So my microexpressions and the other person's microexpressions are both showing. So if I say something,
it doesn't mean it's accurate.
No, it doesn't mean that. So if I'm sending a signal, if I say something to my child and their expectation is that I've misunderstood them and I'm saying no and I'm not listening, they could be really hurt, and I would see that they're hurt, and I would say, wait a second, why are you hurt? Well, because you just said I can't do. No, that's not what I meant. So the microexpressions within a family, if the family is somewhat functional, it gives us the opportunity to say, hey, hold on a second, I feel like that came out wrong, or can I clarify what I meant, or can you clarify why you're upset?
It leaves room for discussion.
Correct. So when I go and I teach for camp counselors at my old summer camp, for example, that's what we focus on, is recognizing distress for early intervention. That, somebody is in a situation where they're not feeling good, where maybe there's conflict between two girls in a cabin. So I missed answering the question that you had earlier about lying. And that was the piece that, if, for example, when we're looking for lie detection, we're looking for, does the facial expression match the words? So that could be as easy as, how are you doing? And someone says, great. And they pucker their chin, and I'm thinking, okay, you're not doing great. Now, maybe you're lying to yourself, or maybe you're lying to me, or maybe you're just simply like guarding your privacy, but you're not feeling great. Or if
was it your clip that Lana Del Rey, is that her?
Yes.
That was your clip. Where they asked her, like, how's married life, and her, and you kind of pointed out, like, she said yes, but her facial expression said something else, and that was interesting, because when you pointed out, it's very visible.
It's very visible. So the facial expression of disgust, again, and the easiest way to see that is the deepening of the nostril shadows, the nasolabial furrow or the nasolabial fold, however you prefer to say it. But it deepens those shadows right next to when you're feeling the no face. And then if I mask that with a smile, and you know where to look, you can still see it next to the nostril, see, right? It doesn't feel like a genuine smile, and you're not getting the smile bags. When we're genuinely joyful, our cheeks pop up and the skin has nowhere to go and it kind of pops out. So what's interesting about that clip is I have no judgment. I mean, honestly, I didn't even know who she was. Someone sent me the clip. I'm old, you know, I'm
That's
53.
right. I
I
was like,
don't
that's her
always
name,
know,
right? Is that her
right?
name? That's her
I
name,
don't
right?
always know people. And my daughters were like, oh, she's, you know, she's a very famous singer. And I said, well,
Yeah.
I probably know her songs and appreciate her songs, but I'm looking at it. And there were some comments about you are judging. And I'm thinking, I'm not judging
No,
her.
no,
I
right.
have no idea what's going on with her marriage, but it seems to me to be a question that if somebody were asking me, and I want to be talking about my art or my movie or my songs, and the person interviewing me is kind of saying, and how's your marriage do? I wouldn't like that.
Correct. So
I'd be
it
showing
doesn't,
disgust too.
and I think that was the misperception. It doesn't mean that she's disgusted with her marriage or her husband. It means that right now in this moment, this is something she doesn't want to talk about. That could be because she wants to promote her music, like you said, or she has to go to the bathroom. I mean, there's a million different reasons, right?
You just stopped me, and I was on the way to say hello to
Yes.
my friend who I haven't seen in 2 years.
Yes.
So my point is, she may be unhappy with her marriage. I have no idea.
Right.
That could be a response to the question, but it could just as easily be a response to, I'm irritated by the question. You see it all the time in interviews and on red carpets.
Yes.
And I use these pictures and videos of people that are famous because for whatever reason, it anchors. And when you're teaching something and you put it in context of something that's familiar to somebody, like, oh, I know her face. She does that all the time. Julia Roberts always does that. You know, she does this. And it's just, I'm uncomfortable in this situation. And again, no judgment. It may not at all have anything to do with the answer to that question.
That's right. Right. I think that's very helpful. That's very, yeah, that clarifies. So, all right, so let's talk about narcissistic personality disorder then. So when you have somebody who is a narcissist, and I'm talking about people that have genuine personality disorder. They're extremely good at controlling their anger, controlling their emotions. They're very good at, you know, acting charming and you know, the life of the party, and then behind closed doors, you know, they're very good at turning it on, turning it off. I guess my question to you is, you know, when people say they can't possibly know what they're doing, and you'll go, yeah, they know exactly what they're doing. They just don't care. But, you know, they're
it's not even that they don't care. They're thrilled by it. They're actually getting aroused by it a lot of times.
They as long as they get what they need, they don't care what mess they leave in their, right, that lack of empathy, right? Like,
correct.
It just,
and sometimes they're excited by it, right? So sometimes it's even so gross as they're
yes, to see you getting knocked down from whatever position you were in, and them being responsible for your downfall, which is why, off topic, it is a myth that narcissists gravitate towards people with low self-esteem. That happens during the relationship. That's what you see at the end of the relationship, a shell of a former person. But in the beginning, the whole reason is
the whole point is to remove the power. That's what gets them off.
And if you don't have any, there's nothing for them to bring down. So you don't get that thrill. You're kind of boring, right? So for a narcissist who knows what they're doing, they lack empathy, they lack remorse. Are you going to be able to see that in a microexpression when, let's say, they're out at a cocktail party and they're acting like they're the life of the party? Everybody adores them. They have no idea what they're like behind closed doors. So if someone's telling them about, you know, they're at a party, everybody loves them, they're life of the party, and somebody's telling them a story about their mother who just passed away, and
as soon as you say that, I pucker my chin. Their mother just passed away, and I pucker my chin.
Now, will the narcissist, because they lack empathy or concern for other people, will they still pucker their chin, or will they not?
Not usually. No.
Okay.
No. Okay. What's really interesting is that they will often pucker their chin when they're talking about their own sadness, their own. I mean, I don't want to be disrespectful, but sob story, like whatever whatever they're saying, and sometimes the sob stories of the narcissist are true and sometimes they're not, right? Correct, or sometimes there's a kernel. What I've often seen is that there's a kernel of truth, but they've exaggerated it so much because it's proven to be a useful tool. And it's almost like they're not even feeling it when they're, So anyway, when they're talking about their own grief or something that's hard for them, or I guess the time I see it the most is when they're talking about somebody not giving them the respect they feel they deserve. Then they're really showing some, puckering of chin. But I almost never see it.
Do you see more anger, microexpressions of anger?
I do, but the thing that, so I don't see the compassion. The empathy is almost, it's really, they might say the right thing. They may even tilt their head and like, they're going to be using more repetitive behavior of the recipe that they have seen that works on TV, or they've seen somebody else be successful with. I don't know any narcissists that are good at microexpressions. I just don't. Part of it is because it's not a field of science that is super well known.
They don't present for you, that you wouldn't have access.
No, and they're not generally looking. Most of the narcissists I have that have worked up my clients where I've been brought on to teach, they feel very threatened by it. They try to say, this is not a thing, this is stupid. They don't dive into it and become obsessed with it.
Well, because they figure it's a way that people are going to figure them out and they'll lose their power.
They get scared, so they show a lot of fear. The thing that I am most concerned about, and as soon as I start, like, this is what I do. Everybody asks me about this lying thing where people look up to the left or the right. I don't believe that at all, because I tend to like do this as soon as I'm thinking and trying to solve. I kind of look all over the place. So anyway, I test everything that I ever hear. And I live this 24/7 with my own face and with my kids' faces and the faces around me. What I look for is if I'm talking about, or someone else is talking about somebody going through pain. It is one thing if somebody doesn't pucker their chin. Sometimes that person is just distracted, or they may be on the spectrum. Maybe they have a hard time sort of imagining themselves into that. It is not a crime not to show or express empathy when somebody else is telling their things. And it could be extraordinarily empathetic person who has a hard time putting themselves into that situation. It could also be somebody who is just, you know what, right now I can't deal with your stuff because I've got 14 million things that I have to accomplish by the end of the day, and you're talking too much.
So it's fair to say that it's a capacity thing, that it doesn't mean they don't have the capacity for empathy. They're just not showing it. Whereas a narcissist, that's not there at all.
Well, so what I really look for is if somebody is talking about somebody's pain, the absence of empathy is not enough for me definitively to say, I'm pretty sure this person's a narcissist. It's a clue. What I do look for is, does somebody raise their informal triangles, their cheeks in delight when someone else is talking about their pain? Are they getting aroused or happy when someone else is suffering? That to me is a problem.
But they don't think that they're displaying happiness because they need to act appropriately. But these microexpressions, it sounds like it seeps out without you even knowing.
It leaks. That's exactly right. So that's my big thing, that when I see somebody actually showing arousal, joy, they're getting a thrill, they're getting off on someone else's suffering. But that I would think the diagnosis is better than I do, but that to me is a red flag that there may be some psychopathy.
Yeah. I mean, that's a hallmark. That's like kind of a hallmark symptom of that cluster kind of, not borderline personality, but kind of that antisocial,
excitement in someone else's pain. The other thing you would look for is there pupil dilation when someone else is talking about, which is we show arousal. Often people talk about right before they get murdered, the person's eyes went completely black, or right before the
person who's doing the murder.
Correct. The person are not murdered because obviously they wouldn't live to tell about it, but trying to murder them. That there's been a lot of discussion that we know anecdotally about people saying the person's eyes turn completely black.
Well, what's interesting is that narcissistic personality disorder, when a narcissist goes into a rage.
Correct.
One of the things that happens is their pupils, people will say it, their eyes turn black. And that's exactly. I tell people, if you see that, you are in danger of your life. Get out.
Correct.
When you see those eyes turn black, and for people listening who have seen this before with a narcissistic ex or parent, you know exactly what I'm talking about. And it's so it pierces your soul when you see this.
It's not something you ever forget.
No. And I don't believe this, but I can understand why people believe this. People say it's the devil. Like that's the image that they get, like this devil reptilian, like it looks that unbelievably scary.
A complete shut off of humanity.
Yeah. You'll hear people describe it as that. So again, I don't but I can understand why they would think that, because this is a really scary thing.
I think it's just sheer evil. I think when we see evil, we recognize it.
But it's
Um,
interesting that you said that that's what
yeah.
happens to their eyes before. That's interesting.
Uh-huh. And so I want to differentiate that between the arousal that's romantic or the arousal that might take place in a business meeting, which is so dilation of the pupils, not that extreme, their eyes turn completely black, but just a dilation or a swelling was what my son was saying. Like when you talk about that guy, your pupils dilated and they swell. And basically that's almost like opening the doors, just a slight dilation of the pupils is like, come in, come in, come in. I want whatever this is. So it can be in the middle of a negotiation when somebody gets to price or scope and you say, oh my God, I want that so much. It's greed, it's desire, it's want. And it is not necessarily a negative thing. And that's a very different thing, again, contextually, from somebody in a blind rage where their eyes, just turn completely black. That's terrifying.
So if we would use this, let's say, one of the things that I do routinely is educate people on the red flags of
Mm-hmm.
love bombing, because
Yep.
we try to get them to identify it before they actually get into this.
Yes.
So if you're in the love bombing stage, what type of micro expressions would you expect and what could you look for?
So the problem with love bombing,
Because it's all a facade. They're,
well, it
they're
is all
playing
a
a part.
facade. They are, and yet sometimes even the person love bombing gets such a thrill.
Yes.
That just like acting,
I
the
see.
person can really live in the moment. I do know people that I would consider not narcissists who got narcissistic traits and are extremely self-absorbed, who use this love bombing as a very effective way to get somebody emotionally attached to them. And then they really turn out to be fairly incompetent partners. And it was all kind of, I just call them actors. And I don't mean that as pejorative to actual actors, but they were playing a role.
Right. They're
But
playing a
I
role.
think in some of those cases, the person really has put on a mask and really like played into that Halloween costume where they're kind of enjoying. And we talked about cocktail parties. Sometimes the person who's a narcissist, who's like, kind of, going around and working the room, is really thoroughly enjoying it. So
Okay.
narcissists are capable of experiencing thrill and having fun and all of those pieces. What I look for is one, just sheer parroting. The narcissists that have tried to date me have to, I'm obsessed with lie detection, or that, there will literally be pieces of my keynote speech that they will pull out and say, like, humans are endlessly interesting. And I was like, wait a second, that's like literally my line. I said that. Or, micro expressions really tell the truth because people can't ever hide who they are. And I'm like, really? And so those are red flags,
They're
right?
testing.
When they take whatever your interest is and pretend like they have been into crocheting their entire life, where this is the kind of, they're really
would you see a micro expression of lying?
Sometimes, yeah, because they'll sometimes, if they're really lying about saying that they're interested in something, it's going to be that it's going to always have an element of disgust. Okay. So, for example, if I'm saying I love reading about vampires, and you're showing disgust, it's like you really probably don't love that unless you're telling somebody like I secretly love this and.
Right.
And I'm feeling a little uncomfortable about it. That could be a possibility, but you're looking for a trend or a pattern. So, for example, Jamie, I'm so excited to hear things are going so well for you, and I'm showing disgust, right? You literally almost want to lean back from the screen and be like, But if I say, I really don't like broccoli, I really, really don't like broccoli, and I have a hard time talking about broccoli without making disgust.
Yes.
And that feels fine.
It's not that these are deal breakers if you're not sure if you're in a love bombing phase and all of a sudden you see one part of their nostril or their chin pucker. That's not a determining factor, but what you're saying is that it's kind of part of a pattern. It's not just one of these things. There's a whole bunch of things. This is just one other tool to use to kind of navigate your way through this to determine if it's
exactly healthy. However, some red flags are big enough red flags that you're gonna run.
Yes, tell us.
And I would say, for example, somebody showing disgust and contempt to a child. I would not let them anywhere near a child. So great to see you. That's a problem for me. I won't leave.
What if it's that they just don't want kids, but they don't?
They're just going to be kind of like, they're not going to lean into my child's space and show disgust.
I see what you're saying.
They are not going to They're just, and you're going to know it in your gut. What I'm
Yes.
working with is putting the words on the stuff that you already
Yes.
know.
So that intuition that we get, that feeling in our gut, we're like, I don't like that person. I don't know what it is. I can't figure it out. They just creep me out. What we're picking up on are microexpressions.
Yes. And
Interesting.
probably
Okay.
other things too, as smell,
Like body language.
body language, tone of voice, like whether or not somebody's speaking up here and their throat, their vocal cords are tight, or whether or not they're relaxed and they're talking more calm, the way we do at nighttime, with somebody that we're comfortable with. But yeah, so I'm looking for the disconnect, the facial expressions and the words not matching. If that's a consistent thing, this isn't good. This is a big red flag to stay away. And you're going to combine that with other pieces that just don't match. I mean, just straight up the red flags. Yeah. But for example, if I'm talking about something that's really painful and somebody's getting excited by their pupils are dilating or their cheeks are popping up, that's a problem. No, thank you. We're done. We're done. Done, done, done. You also look for the qualifiers. Just, I'm a mostly good guy, or I'm usually a kind person.
Right. Everybody's mean once in a while. Right?
Yeah.
So that's great. So those are red flags that people can use to kind of navigate those situations a little bit better, but not to be kind of this all or nothing deal breaker, right?
Yeah, and pay attention. I'm sure you do this with your patients too. Like if somebody has no interests of their own and they're only interested in the things that you're interested in.
Yep.
Yeah,
absolutely.
that's super weird.
Absolutely. So in general, kind of closing this out, microexpressions are things that we can use as a tool, as part of our toolbox, to identify emotions in other people, but we have no idea what they're thinking. This is a separate thing altogether and should not be used as an isolated thing. However, it sounds like even if you're able to read those facial expressions, there are things that interrupt that process, right? Like, as ridiculous as it sounds, like, Botox or, getting a facelift, because it's not able to move and therefore not sending it right.
Yes. And it's going to interrupt somebody who's a new student in terms of their ability. It's going to make it harder for them to read the facial expressions. It is not going to make an advanced student. It's still clear as day. So I get that question all the time with Botox, and I clearly need to do some more work on social media to show faces with Botox. But you still get the basics of it. And so the face is going to move. And the interesting thing of the microexpression is it's subliminal. It precedes the thought process. It's involuntary. We don't
see. That's the part that fascinates me, and what I want people to get is this is something that happens before your brain picks up on what's going on. This is the stuff that is out of your control. And I think it's a little scary, right? But at the same time, I think it's fascinating if you use it in the proper way. I'm thinking, like, if you play poker, this would be like really helpful.
Right. So for me, and I do teach poker players. So for me, as a child who was lied to consistently, where the words were not trustworthy, this gives me, for the most part, it's a burden to see what everybody's feeling every time, but it gives me so much relief because I genuinely know what someone is feeling. Again, not what they're thinking, but if they have bad intentions, it will leak and it will be very, very obvious. And people can't get away with pulling the wool over your eyes.
Yes.
It just
gives you a
defense mechanism.
Yes. Yeah. And it gives you a sense of control. It gives you a sense of empowerment, and it takes the uncertainty out of the dynamic, which for most people is huge, especially if they have anxiety or depression or they're insecure. I mean, to take that uncertainty out of the relationship, my God, I mean, then it frees your head up to do so many other things.
Yes. And the other thing that's really interesting is, yes, it shows us who we can't trust. Most of the people are kind of in the middle. They're not super interested in us. They're not thinking about us, just like you were talking. Not everything's about us. But we've got on the one side of the scale, the people that really do wish us harm or would hurt us or our children or our business endeavors, lying, cheating, betraying.
How about jealousy? Is that part of that?
there's usually a disgust when somebody is doing something well, some things are going well for them. There's a little bit of a narrowing of the eyes too, and a little bit of disgust. And the narrowing of the eyes without the disgust could be like, wait, come again, can you explain this to me?
Like
So
confusion.
again, it's contextually, but if I'm doing this, or if I'm doing this, there is me getting pissed off or something, especially if it's in a context where I should be happy for you, or my
Correct.
words are happy, I'm saying
Yes.
happy things, but I'm showing. But for my kids, it's absolutely made the difference between them understanding who I can trust and who I can't trust. And the beautiful piece is that I was in a conversation this week and someone said, oh, so-and-so really loves you. And the guy standing next to me and I both said at the same time, like I said, I know that. And he said, oh, she knows that. And there's just no question that this friend
Right.
of mine loves me deeply
Right.
and is entirely trustworthy and would have my back no matter what. So
see, I just did it with my chin.
yeah,
I
you
just
just
puckered and my lip went in. Did you see that?
And,
like, oh.
right. And your cheeks raised up just a little bit because that was like tenderness because you were that made you happy and also like that like
that's so funny.
so
I felt
nice.
it.
Yeah. Once you start doing it, you can't. It really, it's disruptive to your day, and that you're like, oh, I felt a lot more strongly about that than I thought I did. And now you're self-soothing by touching your mouth.
I'm telling
people, I drive
covering
people
my face next time we talk. No, but it's I mean, it's fascinating. It's really interesting. I mean, and I would imagine if you do like a progressive muscle relaxation with the muscles in your face, you could probably tell what your mood was all day because it's really based on which
I wake up. Yes, and when I teach a lot, this piece, because disgust is such a good facial expression to teach, and I'm using more and more videos when I'm teaching because afterwards this would ache and I'd be pressing or I'd be pulling at my chin to try to kind of work that tenseness out. So one of the things that I've noticed, for example, when I have a friend who's extremely depressed, we mirror each other's facial expressions. So I had a friend that was, just puckering her chin over and over and over again. And when I would see her face to face for 2 hours, my chin would ache when I get home. And so I started taking the calls instead because then I don't mirror as much. And it would, I was just absorbing the amount of stress. So it would be interesting, especially with your work, to, as you're more and more aware of what your own face is doing, get to that realization, like, how hard a day has this been? Well, this has been a lot of this.
Well, my chin hurts, so it was a really stressful day.
Yeah.
But if anything, it just, above all else, it just forces you to be more present, focused in the moment, which is what we want anyway.
It does, and it's this. There is this beautiful piece. I did some teaching on microexpressions in love and dating for a specific group, and my client / friend, who she hired me initially as a client, we became friends, and she called me up and she's like, this whole pupil dilation where she's dating. She was fairly newly divorced, and she was second time around in her 50s. And she said, I can see when their pupils dilate. I'm like, oh, baby, I got you in the palm of my hand. I can just relax. She said, it changes everything. And so the funny thing is that, especially for us women, and, I'm going to look at that perspective because that's my identity, is this piece of knowing who deeply loves you, who's attracted to you, and who actually cares about your feelings. And that empathy or emotional attachment is all in the chin. And so if you're with somebody and you're romantically attached to them and they're never puckering their chin, when you're talking about anything that's financially, physically, or emotionally hard for you, then that's problematic. That person's just not attached. Once is fine. A couple times is fine. They may be overwhelmed, overloaded. But if you're building a relationship with someone, they may be showing all the signs of arousal and none of the signs of emotional attachment. And if you're looking for something real, that's problematic.
No one's safe. No one's safe. None of you are safe.
Or you're very safe, because if we see you exactly for who you are and you're incredibly kind, you'll also be
right. Safe. But also, I mean, I'm kidding, but this is more so people listening can have other tools and feel in control and have some sense of empowerment in their relationship, to be able to read the other person, to feel safe, to know if they're in danger, to know if it's, trauma showing up that's inconsistent or incongruent with the situation that you're really in. And, all of these things are just extra strategies and tools to make you feel safe, right?
Well, so that's the piece I've spent my life working as a strategic advisor and to CEOs and managing directors and boards, and basically helping powerful men become more powerful. So I kept the microexpressions piece secret for most of my life that I could do that. And I just did business. And and this piece that I'm going out now I've been public in a way that I never was before. And I've gone out and started to teach these skills on social media, probably, I want to say about 14, 15 months ago. Aligning with when I started publishing my books, that my goal is to teach in particular young women, because these are skills that I wished I had and that I had the vocabulary for them when I was really young, to recognize danger and deception in platonic relationships, in romantic relationships, and in professional relationships. And for all the women and young men out there, for example, if you're doing a work interview and the person interviewing is talking about how they're going to promote you and they're showing disgust, they're showing that bad bunny rabbit twitch next to their nose, take that as a red flag. If they're talking about how things are going to go great for you and how excited they are, there should be at least a neutral face or a rising of the cheeks. There should not be disgust that's completely the opposite of those kind words, encouraging words.
Fascinating. Thank you. I mean, I could talk to you for hours about this stuff. It's so fascinating. So for those of you listening, again, if you can watch this on YouTube so you can see the facial expressions that Annie's doing, and you can now watch mine, because clearly, as I'm noticing, I'm doing all these things that I didn't even notice I was doing before. Annie, where can people find you and find your work and all your books and all your good stuff?
So my books are on Amazon, is probably the easiest, anywhere books are sold. I've got Diary of a Human Lie Detector, Facial Expressions in Love, Lust, and Lies. That's the really juicy one with poetry and conversations that are real from my life. If you just want the business version, that's the glossary. You also see that on Amazon and anywhere books are sold. If you look up my name, and I have a book for kids called Annie and the Secret Language of Faces, to teach facial expressions.
I still have to get that. I still need that. That's amazing.
And so my website is under my name, anniesarnblad.com, and all my social medias. I only use Facebook for personal relationships, but everything else I do TikTok, I do YouTube. Most of my stuff is up on Insta. That's the place.
And I'll link all of your stuff in the show notes so people can have that. But thank you so much. You are brilliant. This is fascinating. I could be your student for the next 20 years.
We could hang.
We could hang. So thank you so much. And we will definitely do this again soon.
Sounds great.
All right. Take care.
See you soon. Bye.
Thank you for tuning in to another episode of Next Up Narcissism. I hope you found it useful, but most importantly, I hope you found it validating. Want to work one-on-one with me? Visit my website at drjamiezuckerman.com to book a personalized coaching session, and be sure to check out my on-demand workshops on topics like co-parenting with a narcissist, life after leaving, anxiety management strategies, and more. Again, that's drjamiezuckerman.com. You'll also find links to my interactive workbooks, merchandise, resources, and newsletter sign-up. Next Up Narcissism is as much your podcast as it is mine. I want to hear your feedback and what you want to hear. So make sure to leave a podcast review wherever you listen, or send an email to nextup@drjamiezuckerman.com. Again, that's nextup@drjamiezuckerman.com. Be sure to subscribe so that you never miss an episode. And as always, thank you so much for listening. Make sure to tune in next week to see what's up next on Next Up Narcissism.